everyone. I'm Dr. Dhavashree, and today we are meeting you again with this Kickstart series. And today the topic is this module that we are covering is basically a teaching module. Okay, and all the more there are many things which can come in teaching module, and this is one of the very easy stations that we can do. Okay, and today we wanted to do it a bit little different, and so we have come up with this labor care guide. I'm sure you all would be enjoying this Kickstart series videos, YouTube videos, and this is another attempt from our side where we are reversing the role. And today, this labor care guide, as usual, it has got 2 minutes of reading time and 10 minutes of a performance. But then, since this is a teaching station, I'm making it a little, the preparatory time is little less, 30 seconds, and then we'll have 10 minutes, and then we'll have a feedback from the candidate, from the role player, and tips and tricks of how to deal with the teaching station. Okay, and this is one of my favorite quote, and I do not stop telling this, especially for part 3, because I fear not the man who has practiced 10,000 kicks once, but I fear the man who has practiced one kick 10,000 times. Okay, when you practice one kick 10,000 times, I'm sure you're going to become a master. So this is one thing which I love. So please, the best thing about part 3, to clear part 3, is practicing. So practice yourself, that the examiner cannot stop you from passing you. Okay, yes, with that, this is a teaching station, and I've got 30 seconds, and I've got Dr. Soumya here as a role player. We'll go on to it, and I have 30 seconds for going through this task and the labor care guide which is given. Okay, and I'll take you quickly through that. Okay, my time starts. Dr. Soumya,
yeah,
you want to keep the timer?
Yeah, probably we can keep it from the 10 minutes, Dhavashree. So you can just show them this task, and we can keep it from 10 minutes.
Yes.
Once you show both the pages, then we can keep it 10 minutes.
Yes. Okay. Yes. So the time starts now.
Yeah, you have one more slide, right?
Yes. Fine.
Yeah. So shall we start?
Yes.
Okay. Yeah. Time starts. Yeah.
Hi, Maria. I'm Dhavashree. How are you?
Hi. Yeah, all good. Thank you. How are you?
Yeah, I'm good. Thank you. And I'm aware that you're here to learn about the labor care guide. Now, is there any reasons that why you want to know about this labor care guide?
To be very honest, like I was on the duty and I could see that my ST4 filling this up. I was used to the older partogram and I was really not very sure of how to fill this. And I think I upset my ST4 because he was a little bit angry on me that I do not know this, because it's a very basic. I could see all the midwives, everybody was filling it up. So he actually taught me, but I think it was very quick and I thought I would need a detailed session on the same. And so that's the reason I am here.
Yeah, I really appreciate that you've come forward to learn about this labor care guide. But then, how are you feeling in the department now? I just want to know.
Yeah, it's fine. It's I must admit that I was a little upset when the ST4 was angry, but I think he realized down the lane and he told me he apologized. Probably he was overwhelmed with the work also, but I think it was a good thing that he came back and told me that, like it was because he was overwhelmed and there were a lot of backlogs. So that was the reason. Otherwise, I think everybody is quite supportive.
Okay. Was this the first time he's like that to you, or he's been always like this to you?
No, he's very friendly and I don't think there is anything of concern. Yeah.
That's great. That's great to know that you're happy in the department. But then, do you have any idea about this labor care? You told me that he taught you, but do you I think you have a basic idea, but is there any particular thing that you would want to learn?
No, basically, see, it is a little bit confusing when compared to the older partogram. So if you could brief me what's the difference and why the need for this new labor care guide. I know this is purely for monitoring of the mother and the baby, which is quite helpful because I always like the older partogram better, but this has too many components which I'm unable to understand. So that's the reason I'm here.
That's really wonderful. I think you've gone through the labor care guide and you have found that difference in both. And then the thing is, definitely people who have been using the older partogram are definitely very happy using it. But then there are very important things in the labor care guide which makes us do this. As you rightly said, it is for monitoring. I would go through this, why we are using it, how we are using it, where we will have to use it, and why we will have to use it. Okay. Let me take you through the labor care guide. As the labor care guide, you know, this is the labor care guide which recently has been brought, and it has got, why is that? It is for all pregnant women anywhere across the world. This is a labor care guide which we should be using it for all pregnant women who is going through the labor. Okay, this is for monitoring of the labor. Okay, and this especially helps us in picking up and identifying the problems, complications that arise. Okay, and every level of labor care should be using this kind. So it is not that only the tertiary care center should be using, it can be used in any level possible. Am I clear so far, dear?
Yeah,
Yes.
yeah, I understand. Yeah.
Yes, thank you. As you see here, there are 7 sections. Okay, the previous, I'll come to that at the end once we go through this. Okay, this has got 7 sections in it. And the first section is all about the patient. Okay, all the patient characteristics to be filled in. I'm sure, you know, this is very specific about it, the name, when she has gone into labor, what was the induction type, what, has she gone into spontaneous labor, when did she come rupture her membranes, and is there any risk factor? All these things have to be filled in. And if you see, there are 6 sections below this, and each of it has got importance. Okay, the first is supportive care, which was not there in the previous partogram. Okay, in this, the supportive care, we'll take care of the pain relief, we can take care of the companionship, how the patient is she made to lie down, or is she mobile, or is she, you know, is she supine, which is actually not a good thing, or is she taking oral fluids? See, there are certain, here there is an alert column which you will have to take care. Okay, alert column is just to see whether are we doing good or not. Okay, it is very it talks about itself. Okay, in the first thing, is a patient has incoming companion? If it is no, it is an alert, so you'll have to make a recommendation that she needs a companion. And pain relief, there is nothing, we'll have to give her a pain relief. And if there is a overall fluid, if she's not taking, we'll have to make her, and if she denies taking, you have to mark it as D. Am I clear so far?
Yeah, yeah.
If she takes, you have to put it as Y. If not, N. Okay. And if you see the section, okay, let me take you through one of the filled forms that I have with me. Is that okay with you?
Yeah, yeah, yeah. That's okay.
Yes, yes. See here. So here, if you see, there has been no companion. Okay, which means you will have to tell her that she needs a companion. You can tell her that she can have a companion. And the baseline, the second section is about the baby's baseline heart rate, whether she has decelerations. If you see here decelerations, if it is no deceleration, we'll mark it as N. If there is early deceleration or a variable, we can mark it as V. When do we need to alert? If it is a late deceleration, we'll have to alert. Okay. And coming to amniotic fluid, if we have to see it is clear, it is fine. Otherwise, if there is a meconium, especially grade 3 meconium, we have to be alerted. Or if there is a blood stained B, we'll have to mark it as B, which is blood stained, which is alertable. Okay. And amniotic fluid we have done, and position. Normally, anterior positions are favorable positions. If it is a posterior or a transverse, we'll have to mark it. We'll have to write it down and mark it, which are all unfavorable. So if you see here, anything which is in red, it has to be marked as red, which is alertable. Okay. So you will have to make recommendations on it. Am I clear so far?
Yes, yes. Yeah. Now it makes sense. Yeah. Yeah.
Yes. And yes, and one more thing which I wanted to say is the patient in this SP is supine. Okay, supine is alertable. The patient should not lie down supine. Anything other than the supine is MO, which is mobile, left lateral, you know, if she's sitting or standing, walking, moving, anything other than supine is MO, which is not a problem. Okay. Coming to the third thing is a woman. Okay. Knowing about the woman, especially her pulse, blood pressure, systolic, diastolic, and how is the urine. In urine, we'll have to look in for proteinuria and acetones. Okay. Anything which is 3+, proteinuria or acetone 3+ is alertable. 1+ or nothing, we need to repeat it after some time whenever she voids urine. Okay, is that clear?
Yeah, what I understand is whatever is there in this columns, these are all alertable, right?
Okay. Am I clear so far? Am I clear so far?
Yes. What I understand is whatever given in this site, those are the ones which has to be alerted. Yeah. Okay.
Yes. Perfect. So this is about the baby, mother, and the supportive character. When we come into the labor progress, this is little different from that of the previous labor, previous partogram. If you see here, the contractions are monitored and the duration. In the pair, it is only two things which we monitor. How many contractions? Less than 2 is normal, less than 2 is abnormal, more than 2 is abnormal. Okay.
More than 5.
So when we look at
right? Less than 2 and more than 5.
More than 5.
Yeah.
Yes. Yes. More than 5. Yes. And duration of contraction, if it is less than 20 and more than 60, it is abnormal. Okay. So whatever we observe, we'll have to write it down. And if it is something which is alertable, we'll have to mark it as red with a red. Okay. And in the cervix, this is something very important. Okay. Different from the previous, here the active labor starts at 5 centimeters. Okay. And every 4th hourly we keep monitoring, and at 5 centimeters we mark. So every 4th hourly if we do, so if the woman is 5 centimeters for more than 6 hours, okay, it is abnormal. 6 hours, 6 centimeters if she is more than 5 hours, if she's in labor, it is abnormal. More than 3 hours with 7 centimeters, it is abnormal. More than 2.5 hours, if she is there for 8 centimeters, it is abnormal. And if it is in 9 centimeters and she's in 2 hours labor, it is abnormal. So anything which had to be alerted. But if you see here, she has progressed very well. Okay. And here, if you see this at 10 o'clock, initially 6 o'clock she came in. At 10 o'clock, she's 8 centimeters. And at 1 o'clock, she's full. Okay. She's fully dilated, which is very normal. And we also look at the descent per abdomen. Okay. If it is 5/5 palpable, it is totally inside the abdomen. If it is 0/5 palpable, it is totally inside the abdomen. Here at 1 o'clock, when she's fully dilated, she's 2/5 are palpable, which is normal. Okay. And we look into medications, whether she's on any oxytocin, any medicines, medications if we have given her, or IV fluids. If all these things are all fine, we'll have to mark it. Otherwise, we'll have to mention what we are giving. Okay. With all these things, we'll have to make an assessment. For example, here, if you see, she has got no pain relief. So you can recommend pain relief. The companion was not here. So you can ask her to have a companion. If you see here, she is in a supine position. So you have to ask her to get back to mobile or left lateral other than supine. Am I clear? This is a recommendation or a plan that you will write. Am I clear so far?
Yes.
Okay.
Yes.
So when you see, if the patient, you have seen her at 6 o'clock, and the patient, when you're seeing her after 4 hours, if she is 6 centimeters, where will you mark it?
Okay. So in the column here provided, I would be marking it.
Yes. Okay. That's great. Okay. Yes. You're perfect. You're perfect. Well understood. Okay. Yes. So the difference between, as you had asked me, the difference between this two, the older partogram and the newer one thing is that active labor starts at 5 in the newer one, labor care guide. Older one, it is 4 centimeters. Here, the contractions, if we see we see only the strength and duration, whereas in the older ones, we see strength, duration, and contractions. Here, we see only contractions and duration. How many contractions and duration? Am I clear?
Yes. Your time is done, but
yes,
if you have to see, you can wind up. Yeah.
Yes. So, and here, if you see, there is no supportive care in the previous one, but now we have a supportive care. Okay.
Okay.
So, how do you think, I had taken you through this labor guide?
It was really nice, especially with the example one. So probably once I go back and mark few, I'll get back to you. Thank you.
Yes. And maybe, I'll give you can go into the WHO manual, user's manual, which will give you good idea about how to fill the form. And if you have any trouble, you can get back to me so that I can help you out if you still have a trouble. Is that fine?
Yeah, sure. Thank you.
Thank you.
Yes, as usual,
So,
time is the problem. Okay, I think you did a good job. But my only point is you will not have this chart. So then things
yes,
are easier.
we'll have to. No,
Yeah. So
things are easier and you can mark it on the whatever they
yeah,
have, you can
no,
mark it.
probably you won't get the time. The best way to do is you start with the differences. Okay, you start with the differences of the labor care guide. Like for example, after the support, you go straight to the cervix and the the descent and the contraction, because that's a major part. Later on, you can come back to this because the time management is very vital here. Otherwise, I think you've covered most of the things. Probably, I think the bullying, it was not bullying, but a bit about that assurance. I liked it. And as I said, if there was no, probably I can come with something which is marked also. So in that case, it is easier for you to go with the things. But because in the exam, there will be either I will present to you that I have this, or you will have the plain one. Whatever it is,
Yes.
manage the time accordingly. Start with the differences because I already know what the partogram, and then go ahead. Okay.
Yes.
Yeah, I think it's a well done station here.
Thank you. Thank you, Soumya. And this is the difference that I wanted to put in. So modified partogram and the labor care guide. The active phase starts at 4 centimeters, whereas it's 5 centimeters. Alert line, action line are there, which I forgot to mention. Here, usually in modified partogram, there is a alert line and action line, which is a fixed one. But the labor care guide now has an evidence-based time limits. Okay, there is no cutoff, strict cutoff, but then this is the evidence-based guideline. Am I clear?
Yeah.
Yes. And second stage, there is no monitoring, which I forgot to mention. There is no monitoring in the second stage in the previous modified partogram. Here we have an intensified monitoring and supportive care. There is no recording, no recording in the previous one, but here there is an explicit recording of the supportive care, which actually helps the women have a good care during her labor. Okay. And this is the tips and tricks to handle the teaching station. Never introduce yourself as doctor. Please introduce yourself by your name, and you have to set an agenda why you are here. That is always that. And you have to ask whether she has any concerns, because this could not be only a teaching station, but it can be totally about a bullying. Okay. In that case, this asking for a concerns will help you find out what is the agenda of what is that we are dealing with. Okay. And reasons for the interest to learn, and appreciate if they have come forward to learn. Okay. Bullying, definitely ask how is the junior colleague finding himself or herself in the department. Does she find any difficulty in the department? This will tell you whether it is bullying. Assess the background knowledge. That is also very important. Signpost what you would cover. Okay. Even if you don't find time at the end, like what I did, finally, if you say, I'll give you the source from where you can read, then that could actually get you a bit more marks than what I didn't. Okay. And importance of, you'll have to say why important it is. Ask always, not only about labor care guide, anything about teaching. If it is a CTG, tell them why important it is. Okay. So ask questions in between whether you were clear. That is something very important. That is another thing. Always give and take a feedback. You say, I said, you're such a good learner. So you have to ask, how did it go? Okay. But, and appropriate source to go back and learn. Any opportunity to give them an opportunity to ask questions. Okay. And finally, ask the junior to come back if there is a difficulty. So these are the tips and tricks to handle a teaching station. I'm sure you all would be having a very great time with our YouTube series. And if you have not been subscribed, we would ask you to like, subscribe, so that you would have an access of our all the Kickstart series. Okay. See you again with another Kickstart series, and bye-bye from us. Thank you, Soumya.
Thank you. Thank you so much. Thank you, and bye-bye.